Hello, and welcome to Frontiers in Health and Happiness, the official podcast of the Lee Kum-Shung Center for Health and Happiness at the Harvard T.H. Chan School of Public Health. My name is Ayla Fudala, Senior Communications Coordinator, and I'll be asking experts how to live a healthy, happy life. You're listening to our Virtues for Well-Being series, where we're exploring how core human virtues, like purpose, empathy, generosity, and caring, shape our physical, mental, and social health. Over the course of the series, we're looking at how these qualities are defined and measured, what the science says about their impact on both individuals and communities, and how we can intentionally cultivate them in everyday life. Today's guest is renowned scholar Dr. Emiliana Simon-Thomas, Science Director at UC Berkeley's Greater Good Science Center. Dr. Simon-Thomas leads major research initiatives on topics like gratitude, humility, and love. She has helped bring the science of well-being to more than 1 million learners worldwide through open online courses, as well as through her work co-editing the Oxford Handbook of Compassion Science and co-authoring the Daily Flourish Journal. In this conversation, she'll share insights from the Big Joy Project, an interactive global citizen science initiative that invites people to engage in 7 daily micro-acts to enhance well-being, while tracking their impact on mood, relationships, and even biological processes. Thank you so much for joining me, Dr. Simon-Thomas. To start, could you share how you first became interested in studying positive emotions like gratitude, love, and compassion?
Yes, I'd be so happy to share that. So I was originally interested in how emotions influence thinking and decision making. And as a graduate student, I focused on the easy ones to elicit in a systematic way, which is aversion and fear. When I finished that, I just was interested in the other side of the spectrum of emotional experience. I had also recently had my first child at the end of my PhD. And so I got really interested in these prosocial emotions, these affiliative states that drive us to orient towards the welfare of others. And in studying them, it became more and more clear that they played a central role in health and well-being over the lifespan. And so I just thought this is so important for people to realize that these emotions that drive us to nurture one another, to care, to invest in each other, to form long-term, mutually benevolent, supportive social bonds is actually central to happiness and longevity.
Can you tell me about the Greater Good Science Center, how it came to be created, and what its mission is?
So the Greater Good Science Center at UC Berkeley was created to make it easier for a person to draw from cutting-edge science in the domain of well-being and apply it in their daily lives without necessarily having an advanced degree in psychology or medicine or sociology or public health. Instead, the goal was to find all of the relevant studies that had been recently published and write about them, or offer trainings or learning experiences that were really timely and fitting for, again, people without having a lot of background training in the space. So we write articles every single day on our Greater Good magazine. We also have live programs where we bring luminaries and thought leaders together to talk about topics like gratitude and compassion and awe. We also have a number of online trainings. We have staff who are focused squarely on education, on the well-being of teachers and classrooms. And we have a program that's dedicated to parenting and to workplaces. So across the board, our mission is to get rigorously tested insights and resources into the hands of anyone and everyone so that they can live a healthier, happier life.
For listeners who haven't heard of it before, what is the Big Joy Project and what inspired its creation?
So several years ago, the Greater Good Science Center initiated a project, and the goal was to pull as many exercises, activities, and practices from the published literature that had evidence behind them to suggest that they would benefit well-being or happiness or a related theme or construct like gratitude. And we created a website called Greater Good in Action. And it was like a repository or a library of all the activities that we could find. And then we heard from people, our audience, that it was great, but it was a little bit hard to navigate. And so we decided, in partnership with a couple of more technologically savvy collaborators, to create an interactive program where people would create an account, register, tell us a little bit about themselves, and then we would feed them practices on a regular cadence. Our first project was called the Pathway to Happiness, and it was 4 weeks long, and a person would get 4 different practices for 1 week at a time. As you can imagine, this is a kind of big investment for the average person to sign on to. So at another point in time, some filmmakers who had created a documentary called Mission Joy, Finding Happiness in Troubled Times, reached out to a colleague of mine, Alyssa Appel, a professor at the University of California, San Francisco, to ask if she would be interested in creating an impact campaign to show viewers of their film. The film documents the friendship between His Holiness the Dalai Lama and Archbishop Desmond Tutu. And so the idea was, hey, let's pull the exercises from the Greater Good in Action website and make something that's not 4 weeks, but just 7 days. And let's make the exercises even easier than they might seem. Instead of 8 steps that are really detailed, let's just reduce it to one descriptive instruction for what to do and give it to people for 7 days and measure how much they do and how it impacts them. And that is how the Big Joy Project was born.
Well, I actually signed up for the Big Joy Project a couple of days ago, so I've been trying some of the micro acts myself. Day 1 was listening to a short clip of people laughing, which was interesting. I could see how that might affect people differently depending on the context. But day 2 really landed for me. The prompt was to ask someone you care about to describe something that brings them joy. And right around that time, my little sister texted me a picture of some stained glass art she made in a workshop. I was on the subway in the middle of a crowded commute, and I had been in a bad mood, but as soon as I got that text, I started smiling. I felt so happy for her, and it genuinely shifted my mood. So that experience made me really curious about how these micro acts are designed. Can you tell me more about them and what people might expect as they go through the 7 days?
Yeah. Funny that the shared laughter exercise was, it sounds like you had some ambivalence about it. That's not uncommon. But it is pretty well documented that being in the company of others, it might work better for you if it was you and your little sister and maybe others in your family who were all laughing together, where it felt like more powerful. I'm glad that the capitalizing on positive events micro act worked for you. And what you should expect for the next 7 days is a little nudge in the morning that asks you to go to the website and then invites you to try another one. I think one of our hopes is that these micro acts aren't done just once in the context of the digital interface of the Big Joy Project, but that maybe they serve as some kind of inspiration, right? There's great evidence for the physiological and mental benefits of laughter, right? It gets us to exhale in a way that activates our vagus nerve. It's physiologically calming. It's socially affiliative. It signals safety to others. It creates a sense of kinship. So there's lots of benefits to laughing. This is just kind of like a teaser, just like an invitation to maybe imagine laughing more in your day-to-day life. One of the things I wanted to say about the Big Joy Project is that we frame it as an exploration, as a citizen science project, meaning that we're inviting everyone who does it to really self-reflect about whether each one of the microacts is effective for them. And it's absolutely, completely, and totally fine for any individual to be like, ooh, that one didn't do anything for me. And so that was part of the goal of the Big Joy Project, was to try to begin to contribute to that space of knowledge around what works best for whom, and how can we give someone the kind of experience or activity that is most appealing and also most impactful for them.
Your analysis of the data collected by the Big Joy Project showed that financial strain predicts drop-off in Big Joy Project participation. What does that tell us about the relationship between economic stress and people's ability to engage in well-being practices?
Yeah, I mean, I think the short answer is that when you're experiencing financial strain, you're probably also experiencing time poverty. You're also probably super busy trying to manage all of life's challenges, to secure the resources that you need to support yourself and your family or your community in whatever way you can. It's not so much like a basic ability or inability to engage so much as it is how could I possibly respond to this little email nudge telling me to take 10 minutes to noodle around with a microact of joy if I'm really otherwise experiencing significant demands on my time and energy. Or maybe it's just too stressful. It just doesn't feel like it makes sense if my basic needs are not met. Our financial strain question is pretty serious. It's have you had difficulty meeting your basic needs like food, heat, housing? And so if somebody's scoring themselves low on that, yeah, that's the Big Joy Project is probably not the best fit. We need as a society to do a better job of providing for those basic needs. And once that's there, you could imagine that engaging in the Big Joy microact activities could be of a better fit.
You also found that younger participants tend to report greater benefits to well-being. What are some possible explanations for this age difference, and what might it suggest for tailoring interventions across the lifespan?
Yeah, no, that's an interesting one. Our age effects, I think, aren't so much about a greater impact on young people so much as a greater baseline amongst people in the older age groups in our sample. So one of the limitations of the Big Joy Project is that it is a self-selected, self-scheduled experience. And we know, for example, that the majority of our participants are older, female, from the U.S., and white. And so this represents a couple of issues. One, that's who positive psychology interventions tend to appeal to. That's who's interested. That's who's looking around for these kinds of resources. Two, that's where the science has been conducted, right? A lot of psychology, in particular positive psychology, science has been done in the so-called weird sample, right? Western, industrialized, educated, what's R? Democratic, religious, democratic, I don't know. Anyway, it's not a magnificently diverse and representative sample. So we think that young people came in scoring a little bit lower, and when you come in scoring a little bit lower, there's more space to improve. And then there's also the possibility that young people are engaging in a different way given their fluency with technology, their comfort with a technological platform. We really don't know the answer, but those are two possible things to take into consideration.
One of your findings is that greater adherence to the microacts is tied to stronger endorsement of prosocial values and norms. How do you interpret this link?
There's a great controversy / friendly conversation in the space of promoting well-being or happiness around the frequency and duration of practice, right? Does a person need to do a well-being promoting exercise just once for 2 minutes? Do they need to do it every day? Do they need to do it 3 times a week for 6 months? Do they need to do it for 10 weeks? There are lots of different ideas and approaches out there. I think that there's across the board little controversy over the observation that more tends to be better. So if you do yoga 8 times over the course of 2 months, you're going to gain more strength and flexibility and maybe kind of mental health benefit than you would if you just engaged in one class once. There's also the possibility that variation is beneficial. It may be that our decision to choose 7 different micro acts over 7 days, rather than have someone do the same practice every day for 7 days, was an advantage because they had kind of this more diverse and dynamic experience. We asked people questions about their willingness to forego personal comforts in order to benefit the welfare of others or even to benefit the natural environment. Those were 2 of our prosociality or prosocial sentiments questions. And yeah, anytime there's a more investment and more repetition in an exercise that is meant to, at some low-lying level, strengthen a person's sense that they're connected to others, that they belong, that they matter in the world. And that's all kind of woven into the Big Joy Project. I think that there's good cause to predict that there would be a greater endorsement of a statement like that.
For listeners who may be under financial or emotional strain and feel skeptical that small daily practices can help, what would you say to them? And is there one simple micro act you'd encourage them to try first?
Ooh, great question. There are, and appropriately so, skeptics out there who worry that positive psychology interventions are indulgent, self-care, kind of not really relevant to them. When I have conversations with folks like that, my invitation is really just, try one. You don't know until you try it. And sometimes you have to let go of that initial disgust or expectation that it's not relevant or somehow just inaccessible and just try it. Amongst our micro acts, probably the one that has the most evidence behind it is gratitude. We invite people to list 8 things that they're grateful for. According to our data, a newer field of research, one of the most powerful exercises or micro acts was having an experience of awe. And we invited people to watch a brief video that was of a natural scenery and environment with kind of uplifting musical soundtrack. And there's lots of good data now showing that awe has benefits to well-being. And, for the skeptic, we don't know what works best for everyone, but try them and see if any one of them makes sense to you and has an impact. And be open-hearted and open-minded.
Okay, one last question about the Big Joy Project. Where do you see it going in the future? How do you hope projects like the Big Joy Project and the broader science of compassion and prosocial behavior will shape the future of health, happiness, and public policy?
Oh, that's a big question. Well, in terms of the Big Joy Project, one significant limitation is that all of our science thus far is a single sample kind of analysis. We are in the process of deploying functionality on the website that will enable us to create an active control condition, an experience where we invite people to do a thing every day for 7 days that is not a micro act derived from a well-being promoting exercise, but it's not harmful, right? Maybe it's try to remember 7 places that you visited today, right? Instead of write down 7 things that you're grateful for. Maybe it's 8 in both cases. But in either case, in order for us to have confidence that our impact on well-being is causal, we really need that kind of randomly assigned active control comparison data. So that's in the pipeline. We're also super interested in gathering physiological data. So could we actually show that there's a change from before beginning to after completing 7 days of Big Joy to biomarkers that are associated with health and well-being? Maybe we go back to our 4-week pathway to happiness and try to imagine across those 2 different programs where we can have the biggest impact, both on people's felt experience, but also on the physiological and neurobiological underpinnings of health and well-being.
Wow, a lot of exciting things in the future of the Big Joy Project then. Now I'm going to ask about the Science of Happiness courses. You serve as the co-instructor of the Science of Happiness and the Science of Happiness at Work online courses. The Greater Good Science Center website said that students who completed these courses report significant increases in happiness and decreases in their levels of stress and loneliness. And I would love to be happier and less stressed, so of course I had to sign up. So now I have a couple of questions about it. First, how did you and your co-teacher, Dr. Dacher Keltner, the founder of the Greater Good Science Center, decide to create these courses?
So the Greater Good Science Center, in its initial format, really was just a translation resource. So we were taking science and translating it into articles and programs that were accessible to the general public. If a person wanted to learn something in an organized, systematic, sequential way, we really didn't have much to offer. And it became clear that that would be a value. Also, Dacher Keltner, who's a professor of psychology at UC Berkeley, for years has been teaching a class on campus to undergrads called Human Happiness. And there was, again, this kind of like, okay, we understand the value of a deeper and sort of narratively coherent experience that covers all the ideas in happiness science. And we have so much content. Let's build a course. And yeah, that was it. We didn't want this to be available only to people who are smart enough and resourced enough to apply to and be accepted to UC Berkeley. We wanted this to be available at a global scale. And this was the beginning of the massive open online course kind of momentum. And we thought it would be a great idea. We saw that there wasn't another one yet. Most of those courses were focused on coding or computer science. And we thought, well, let's do one on the science of happiness and see what happens. We hoped that we would get, 25,000 people around the world to enroll. But that was the same year that Pharrell Williams launched the Happy song and the Happy video. And I think that was a great push towards our course because we ended up getting 125,000 people enrolled in our very first run of the Science of Happiness on the edX platform. And we've been sort of retooling and updating and relaunching it ever since.
What should I expect as a new student in the Science of Happiness course?
So we made the Science of Happiness course something that has reading videos that explain concepts and key ideas that walk you through studies, but also has interactive elements in it. So there are so-called happiness practice units throughout the course, which are pretty similar to the micro acts in the Big Joy Project, but maybe a little bit more detailed and a little bit longer, a little bit more involved, because we weren't concerned when we made the Science of Happiness class about brevity, right? We wanted people really to learn and to feel and to experience something. You'll also have problem sets, right? There'll be points where you get to demonstrate what you've learned. There are lots of surveys called self-inquiry embedded throughout the course so that you can get a feel for how scientists actually assess and measure different concepts within the science of happiness or related to well-being. And there are discussion forums throughout so that people who enroll in the class can have some opportunity to interact with others around the world who are also enrolled in the class.
12 years and more than 1 million students later, what have you learned from teaching these courses?
People are really hungry for this knowledge and for the practical tools for applying it in their own lives. I speak about this topic or these topics often, and I'm very lucky because nobody ever comes up at the end and says, that was so boring, right? Everyone's like, oh my God, I've been waiting. I've needed this so much. I wasn't surprised necessarily. That's what what audience or students say, because they've heard some of these ideas from their parents or their grandparents or their communities, or maybe their spiritual communities or religious practices. But to hear it validated in a scientific way and sort of distilled into clear and actionable steps is really empowering. That's one of the findings that I love from Big Joy. Is at some point when we were trying to figure out, what questions are we going to ask? And we were trying to be very disciplined about this because we didn't want to have an 85 question survey in the beginning of the experience. But we also wanted to be able to tell a rich story and understand something important. And one of the questions we decided to include was about people's sense of agency over their own happiness. Do you feel like you can do something about it? Do you perceive your happiness as this sort of fortuitous thing that is determined for you based on, when you were born or some other aspect of your life context or personal characteristics that you feel you may have inherited? When people learn about the science of happiness and the practical ways that you can engage with exercises, activities, and practices and prioritize your time and energy to actually improve your happiness in a measurable way, they feel really empowered and they have a greater sense of self-efficacy and agency over their own happiness in life. And that's beautiful and important to me. And the second part of it is the realization of how essential our sense of connection with others, our tendency towards generosity, and our feelings of belonging and community are to all of it. Right? That prosocial sentiment, that urge to invest in the welfare of others, to give, to be generous, to cooperate, to coordinate together our efforts to accomplish great things is so fundamental and not what the advertising powers that be tend to tell us. And so I really draw a lot of personal meaning from the possibility that somehow learning about this is making any one person just a little bit kinder and have a little bit more confidence in how much they matter to the communities that they participate in and day out.
That's incredible. Thank you so much for sharing that with me and with our audience. What are some of the key takeaways from the courses that seem to resonate most with participants?
Gratitude is really important. They already feel that way, and that the reason it might be lacking in their day-to-day lives is that we fail to express it to each other. It's easy not to acknowledge the important ways that each of us acts to benefit each other. And it turns out that expressing that makes the experience of gratitude more available. When we don't say it, we don't feel it. When we don't hear it, we don't feel it. Yet we know it's this essential and core aspirational virtue. Very few people ever raise their hand and say, I don't believe in gratitude. Everybody's like, I get it. Yeah, of course. But I don't see it and feel it enough. Yeah, okay. When parents ask me, how do I make my children more grateful? I'm like, you have to be the role model. You have to thank them, and you have to thank them in a specific way. And I don't mean according to a script. What I mean by specific is point out the strength and the effort that another person has extended in order to do whatever it is that they did that brought some goodness into your own life. If you really name that, it's a more powerful experience for you and the other. And so I think gratitude just gets rich and possible when people learn about it. Another insight that I think people really value from the science of happiness and the way that we teach it at the Greater Good Science Center is the importance of relationship, the importance of connection. And I don't mean having 1,000 friends and being really popular. I mean having, at least one person to count on when you're going through a difficult time that you can be vulnerable with. One person who relies on you for support so that you can feel like you're contributing to something that is truly valuable. I think people get that. Like there's all these things that people know, but then don't experience or don't do. And when they learn the science of happiness and they get that kind of evidence base behind it, there's a greater sense of, oh, I'm going to do this. I hear that it's actually legitimately valuable and it can change my life for the better, and I can do it on my own or with my community or with my close family and friends and feel the benefit. It's funny to do a study where you're relying on a self-selected audience. You get people who leave, but we were surprised with the Big Joy Project and also with the Science of Happiness course at how many people stay. And I think the reason they stay is because they try stuff and it works. They try stuff and they don't need to get $10 for doing it. They try it and they feel something and they realize, oh, this matters. This is an improvement that I can add into my own life. And so I'm going to have that kind of organic reinforcement rather than an external reinforcement and pursue this change that is, going to benefit me. I think people are really excited about the longevity findings too, right? There's all this data that people who are more optimistic live longer. People who smiled in their college yearbook photos live longer and have more satisfying marriages or personal close relationships over the course of their lives. So again, seeing those little data points and feeling like, oh, I want that. And I've tried just one little tiny bit of it and it's felt right to me. Now I can go do it.
Being an expert on the science of happiness, do you feel like you've become an expert on your own happiness? Do you know what makes you happy? And do you think that's made you happier?
So I do get this question fairly often, which is, okay, so you're the happiness scientist and you go around talking about happiness all the time. Aren't you the happiest person? And my answer is that it takes work. And yeah, I do know a lot about what the strategies are and what the tactics are and where the opportunities are to improve upon my happiness in life. And, do I actively invest in my own happiness at the level that I think would lead me to be the happiest person in the world? Probably not. Right? It's something I have to think about every day. I have to make decisions in the service of my happiness and remember that those decisions aren't based on immediate gratification or pleasure, right? Sometimes those decisions are, I'm going to do something a little bit hard. I'm going to do something that feels like it's not going to be rewarding in this moment because I have my future self in mind and I'm thinking about a bigger, important facet of my personal life that I want to invest in. So it's always a challenge. And maybe for me, the added challenge is that knowing as much as I know, I have to not judge myself for not doing everything that I should. I have to exercise self-compassion, right? Which is, okay, this is hard. And, Emiliana might feel like she's inadequate or making the wrong choices, but that's a good signal to maybe make a better choice, a more fruitful choice moving forward. Maybe those choices are about how I interact with friends and family or colleagues. Maybe they're choices about how often I express my own gratitude. I try. Maybe those choices are about smiling and giving a compliment to the barista who is making a latte for me. Like, I can not do that and just kind of keep to myself. I think of myself as a little bit more introverted than extroverted, despite my popular kind of depiction. And so I'll tell myself, like, okay, I know that I could say something kind in this moment, and I'm going to do it, even if it feels slightly costly energetically, because I know that the payback to that kind of loose tie with this person who I'm interacting with is going to be beneficial both for me and the other person. So it's a journey. I keep doing it. And yeah, I do feel pressure to walk the talk, and I do try to walk the talk, but I'm far from perfect.
What brings you the most joy and happiness?
It's hard to answer that question without sounding kind of, ordinary or mundane. And it kind of depends on where I'm at in a given moment. If I'm sitting at my desk for, the 3.5 hour looking at my screen, standing up, going outside and looking at a tree's leaves or a blossom, or if I happen to be working from home, going into my backyard and watching my hens cluck around for 5 minutes, maybe finding an egg. I can't describe how oddly delightful it is to open up the little door and see an egg that came from one of these, living birds in my backyard. So that's one example. In a moment of chills in my neck, I think of watching my own children perform. My daughters are both athletes, and I love to go watch them play their hardest in their respective sports. It just makes me feel, open in my chest, and my shoulders go back, and that kind of shared pride with them and sense of belonging that comes up is really powerful. And I do like going to yoga classes too, but that sounds kind of like self-care. But it matters. It matters to exercise. It matters to sleep. It matters to pay attention to your diet and make sure you're eating in a healthy and nutritious way. I make sourdough bread. My little sourdough starter is one of my pets that I like to pay attention to. So, a number of different things. It's not just one thing, but I also love going to see live music and comedy. Situations where there's lots of people all together laughing and or swaying in the same way rhythmically to something that is appealing and has a positive message. That is something that brings me joy.
That's beautiful. My final question is, do you have any parting words you'd like to share with our listeners?
You're incredibly important. And what you do every moment matters. And spreading goodwill, kindness, generosity in every way that you can is our only chance to a peaceful and innovative existence as a species. It's the thing that works. It's the thing that we've evolved for. It's our biggest adaptive advantage, and it takes deliberate and intentional prioritizing to do it. And if you can, we'll all be grateful.
Thank you so much to Dr. Emiliana Simon-Thomas for joining us today and teaching us how small daily acts rooted in compassion, gratitude, and other virtues can meaningfully boost our well-being, and how projects like Big Joy are helping to make these science-backed practices accessible at a global scale. Be sure to tune in to the final episode of our 6-part series on virtues and well-being in 2 weeks. This episode will feature Dr. Demond Hill, Assistant Professor of Health Equity at Tufts University. Dr. Hill will explore the power of awe to transform awful spaces into awe-inspiring ones and illuminate new pathways for collective flourishing. This has been another episode of Frontiers in Health and Happiness, the official podcast of the Lee Kum-Shung Center for Health and Happiness at the Harvard T.H. Chan School of Public Health. To learn about upcoming events, visit our website, sign up for our mailing list, and follow us on LinkedIn, Instagram, Blue Sky, Facebook, and YouTube. New episodes in our Virtues for Well-Being series will air every 2 weeks. Episodes can be found on the Lee Kum-Shung Center for Health and Happiness website and YouTube channel, as well as on Spotify, Apple Podcasts, and wherever else podcasts are found. Thank you for listening.